Good morning and good afternoon, and thank you for attending today's webinar on cost share assistance programs. Before we get started, some housekeeping items. Attendees will remain muted throughout the presentation. Please submit any questions you have through the Q&A button toward the bottom of your Zoom window. I will compile questions throughout the presentation and moderate a Q&A toward the end of the webinar. We will share a copy of this presentation to attendees after the presentation. As you all know, affordability is a leading barrier to accessing provider-administered medications, and manufacturer cost-share assistance cannot be used by beneficiaries of federal health care programs like Medicare Part B. As such, it is critically important to understand the options for cost-share assistance, where the dollars are, and how to effectively navigate these programs to secure assistance for your patients. To that effect, I'm confident that today's session will be valuable for you, so I'm quite excited to partner with the PAN Foundation to deliver today's webinar on this important topic. If you find that you would like to learn more about this topic and others that impact patients relying on medical benefit drugs, we would love to see you at the National Infusion Center Annual Conference this June in New Orleans. You can go to infusioncenter.org to learn more. And with that, I am Brian Nyquist, and I will be your host for today's webinar. I serve as President and CEO for the National Infusion Center Association, the nation's nonprofit trade association fighting for outpatient infusion settings like yours. I'm thrilled to be joined by our colleagues from the PAN Foundation. Amy Niles is an Executive Vice President at PAN. She oversees PAN's relations and partnerships with the patient advocacy community, in addition to leading its public policy and advocacy initiatives. Audrey Corte is the Senior Manager of Provider Relations for PAN and helps to develop and implement PAN's provider outreach strategy. For those of you that are not familiar with NICA, we are the nonprofit trade association formed to support and represent your infusion center business and champion your value and cost savings potential. We advocate and lobby on your center's behalf to ensure that you can continue delivering high-value, cost-effective care in a safe environment. To learn more about how NICA works for you, visit our website at infusioncenter.org. Now, I'm very excited to hand it over to Audrey to introduce the PAN Foundation and run through the agenda.
Thank you so much, Brian, for that warm introduction. Hello, everyone. My name is Audrey. I'm the Senior Manager of Provider Relations at PAN, as Brian said, and I'm glad that you're able to join us this afternoon for this joint webinar between NICA and the Patient Access Network Foundation. So the PAN Foundation is a nonprofit organization, and we help underinsured people with life-threatening chronic and rare diseases get the medication and treatment they need by assisting them with their out-of-pocket costs for their prescribed treatments. And we also advocate for improved access and affordability, which you'll hear a lot more about later. Next slide, please. Today, I will introduce you to who we are, why we do what we do, and how you can apply and receive assistance with PAN, and share industry norms and additional resources beyond the PAN Foundation. So let's go ahead and get started. Next slide, please. So in our line of work, we have come to know that access to medically necessary treatment is critical for successful health outcomes. We also know the high out-of-pocket costs can block this access and impact quality of life, medication adherence, and of course, the course of the disease. So a Kaiser Family Foundation study found that on average, Medicare beneficiaries spend 41% of their Social Security income on out-of-pocket cost, and this number is projected to rise to 50% by 2030. The same study found that, and another slide, please. Thank you. So the same study found that 51% of US adults reported skipping or delaying medical care due to out-of-pocket cost. So what is out-of-pocket cost? So out-of-pocket cost is also known as cost sharing and refers to healthcare costs that the insurance plan requires the patient to pay out of pocket for covered healthcare services. They appear in the form of deductibles, co-pays, co-insurance, and insurance premiums. So patients with insurance who cannot afford the out-of-pocket cost of their treatment are considered underinsured. Next slide. So in 2021, Morning Consult conducted a survey to measure patient satisfaction and the perception of services provided by PAN and other charitable copay assistance foundations. The report found that support from charitable foundations affected medication adherence. In fact, before receiving financial assistance from PAN, an estimated 54% of patients reported that there were times that they did not take their medication or took fewer doses than prescribed because they were worried about the cost. Next slide. In another study, an estimated 94% of patients reported that support from PAN made them more likely to take their medication as prescribed and had a positive impact on their families. So as you can see, all the evidence points to a genuine need for copay assistance foundations for the underinsured population. Next slide, please. And we know that PAN is not alone in assisting patients with their out-of-pocket cost. In fact, there are 9 total charitable copay assistance foundations, including PAN, that helps to relieve the financial burdens caused by rising out-of-pocket costs. These foundations are nonprofit organizations, and they assist underinsured patients with financial support for their prescribed treatment. They are regulated by the Health and Human Services Office of Inspector General, and each one operates under the Office of Inspector General's advisory opinion, and the opinion provides guidance on how to stay compliant. Also, each of the foundations operates nationally to assist patients across the country. Next slide, please. So although each foundation has its own OIG opinion, there are similarities in how we operate. For instance, almost all our programs are diagnosis-based, meaning that the patient must have the illness in the named disease fund you enroll the patient in. However, it is essential to note that some foundations also cover additional subtypes of the disease state. So it is always crucial to review the specific foundation's website or contact them directly to determine all the qualifications for each program. Another similarity we have is that each foundation has program eligibility requirements such as insurance type and income guidelines. And then also, each foundation has an eligibility period that determines the length of the grant. Now, most disease funds have a 12-month eligibility period. However, many foundations also offer a look-back period to allow you to submit past claims when you enroll the patient in the disease fund for the first time. So some offer a 3-month look-back period, while others offer 6 months. So it's always important to check with them directly and also know these parameters so that when you're submitting claims to them, you can submit past claims if they do cover that service. What's more, some foundations also have calendar year assistance. And what this means is that the copay assistance starts at the beginning of the year and then goes until the end. What is different about this is that if a foundation operates this way, then that means that the disease fund opens at the beginning of the year. So it's always important to be knowledgeable about this information as well. In contrast, other foundations operate on a rolling calendar year, which means that the disease fund opens when the foundation receives assistance throughout the year, allowing flexibility to enroll your patients any time of the year when funding is available. Then finally, most foundations allocate specific assistance amounts per disease fund. However, that varies depending on the foundation. So some foundations provide an opportunity to receive additional funding when the money runs out of the grant throughout the year. So it's always important to check all this information. Next slide, please. So the main programs offered by charitable copay assistance foundations are copay assistance funds. However, some also offer premium and travel assistance. Now, here's the list of all of the National Charitable Copay Assistance Foundation. Some offer more services than what is listed here on the screen. But to know more and to learn more about each foundation, it is best to reach out directly to them. Next slide, please. So other resources to find medication support for your patient includes drug manufacturer assistance program, as Brian mentioned earlier, which are all of them are medication specific, and they usually have their own eligibility criteria. You can learn more about the manufacturer assistance program through web-based resources like the Association of Community Cancer Care Reimbursement Guide and Needy Meds and RS Assist websites. On these websites, you can type in the name of the medication and find the manufacturer assistance program available for that drug and the foundation assistance available for that for the drug as well. Next slide, please. One more. Thank you. So a little bit more about the PAN Foundation. So as we discussed earlier, the PAN Foundation is a nonprofit organization, and we offer grants to pay for co-pays, co-insurance, and deductibles, and some premiums as well. But since its founding in 2004, we have provided over 1 million underinsured patients with $4 billion in financial assistance. Next slide, please. So we offer a fast and reliable way to get financial assistance. And our goal in this joint webinar is to help you identify financial resources to reduce your patient's out-of-pocket cost. Next slide. One more. Thank you. All right, so now we will learn a little bit more about the specific programs at the PAN Foundation. We have 3 assistance programs to help your patients with their out-of-pocket costs. So first, what we offer first is the medication assistance program, or the copay assistance program. Now, this program assists patients with deductibles, copays, and coinsurance, as we just talked about earlier, for your prescribed medication. The second program we offer is our premium assistance program, which assists the patient in paying monthly primary or secondary health insurance premium. The final program is our transportation assistance program. We broadened our transportation assistance program last year to include all disease funds, and the program covers travel expenses from the patient's treatment visits. So we cover expenses such as car rental, airfare, parking, and public transportation. We also cover approved lodging such as hotels, Airbnb, and temporary housing. And to qualify for our transportation program, the patient must be actively enrolled in one of our disease funds. And all our assistance programs are provided in the form of financial grants to help the patient pay their out-of-pocket cost. Next slide, please. You. So we offer 70 disease funds in chronic, rare, and oncology disease states, including the COVID-19 Financial Support Program, which we launched in 2020 to support those affected by the pandemic. And we will learn more about that program a little later. And to see a full listing and current statuses of all our programs, please visit our website at panfoundation.org. Next slide. So one common question we receive from our healthcare providers and pharmacies is what medications we cover. But before we get to that, I want to note that all our disease funds are diagnosis-based, and we have a list of all acceptable diagnosis and disease fund subtypes under each disease fund page. Later, we'll take a look at an example of this page so you will know where to find the information. In addition, every disease fund mentioned on the previous slide has its own formulary of drugs considered for reimbursement. And on our formulary, we cover FDA-approved medications or medications listed in official compendia or evidence-based guidelines for the specific disease state. So this includes all prescription medications that are brand, generic, biosimilar, specialty, or radiopharmaceutical drugs. And very few funds also cover medical supplies for administering treatment. An example of this is our Parkinson's disease fund. Now that you know what PAN covers, let's quickly review what we do not cover, as we receive requests for payment for these services and products as well. So PAN is a pay of last resort. And what that means is that we pay the patient responsibility after the patient's insurance makes a payment. So we do not cover medication that the insurance did not make any payments on, or that the insurance covered at 100%. Also, if the medication is not on the disease fund formulary, we do not cover it as well. However, there is an exception to this rule. If a medication is indicated or guideline recommended for a specific disease state, but is not listed on our formulary, you can submit a request or on our website, or you can call us and you can add the drug to our formulary for review. We will review the request and then we'll provide you a determination. Then finally, we do not cover services such as doctor's visit or lab work, any ER or hospital visit or diagnostic testing. Next, please. One more. Thank you. So our grants provide 100% assistance support for most of our patients. We look at the claims data to determine how much a patient is going to need for a specific disease fund. Then we allocate a certain dollar amount to that fund. If the patient needs additional assistance because the out-of-pocket cost is higher than the average, then we offer second grants to cover the remainder of the enrollment period. So this means if the disease fund is open at PAN and you run out of funding before the enrollment period ends, you can apply for additional assistance and we'll be able to provide more funding for the remainder of the eligibility period. We also review all assistance amount annually to adjust and ensure patients receive adequate financial support throughout the year. Next slide, please. So we have 3 disease fund statuses at PAN, and I want to note that this is very important for you to know for all the different foundations, because the fund statuses determine when you can apply for assistance for your patients. So we have 3 fund statuses at PAN. We have open, closed, and open and waitlist only. So when the fund status is open at PAN, what that means is that funding is available and that the disease fund is open for the general public to apply for assistance. When you see the fund status as closed, it means that funding is not available for that specific disease fund. But please note that this is the only status that you can add patients to the disease fund waitlist. We recommend that you add your patients to the waitlist when the fund is closed to secure a place for you to receive a notification when the fund opens in the waitlist only status, which brings us to our final status, open in waitlist only. This status means that funding is currently available. However, it is only open to those on the wait list. Individuals on the wait list will receive an email during this status asking them to apply for assistance with PAN. Once they apply, we determine eligibility and allocate funding to individuals on the wait list. And after funds are fully allocated to those on the wait list, then we'll open the disease fund to the general public. It goes back to the open status again. So it's crucial to understand the different fund statuses at PAN to optimize your search for financial assistance. Next slide, please. So the next few slides will focus on applying for assistance with PAN. We can go one more, thank you. So there are 4 easy steps to keep in mind when you're applying for assistance. The first one is to check to see if the fund is open. The second is to review all the eligibility criteria. Then third, gather all the required information. And then fourth, contact PAN to apply. So we'll take each one and review it further. Next step, please. So step 1 is to check to see if the disease fund is open at PAN. There are several ways to do this. You can go on the PAN website at panfoundation.org and type in the name of the disease fund or medication on the homepage. You can also verify fund status on our provider or pharmacy portals under the disease fund and medication tab. Then finally, you can call PAN to verify the status of all our disease funds. Next slide, please. Step 2 is to verify if the patient meets the eligibility criteria for the disease fund in which you're applying on their behalf. So the first step is that the patient must be getting treatment, or the first criteria is that the patient must be getting treatment for the disease fund that you apply for assistance. So this means that if you apply for assistance in the asthma fund, the patient must be diagnosed with asthma or one of the subcategories of asthma under the asthma disease fund. The second criteria is that the patient must have health insurance that covers the qualifying medication or product, which we discussed a little bit earlier. The third criteria is that the medication or product must be listed on the fund formulary. So each disease fund has its own formulary, and that medication has to be on there. And the fourth is that the patient must live and receive treatment in the United States or U.S. territory, although U.S. citizenship is not a requirement. Now, if the patient is not a U.S. citizen, we recommend that you contact us and we'll be able to help you to apply for that assistance. And then the final criteria is that the patient's income must fall at or below 400 or 500% of the federal poverty level specified by the assistance program. And as noted earlier, the insurance and income guidelines vary for each assistance program. So verify this and all the program guidelines on the specific disease fund page. Next slide, please. So this is an example of our disease fund page on our website. This example shows our Parkinson's disease fund. And if you review the page, you can find the assistance amount, eligibility criteria, as well as medications covered for reimbursement and covered diagnosis codes. On the right corner, you can start the entire application process on the disease fund page. And that is one convenience that we provide for our healthcare providers and pharmacies, as well as patients as well. Next slide, please. So this brings us to step 3. Gather all the required information before starting the application process. So first, you're going to need demographic information such as the name, date of birth, address, and so on. Then you're going to need the diagnosis and the medication name. Next, you need to collect the patient's health insurance and physician information, along with the income and the number of people in the patient's household. Next slide, please. Okay, so now you're ready to submit your application. There are 3 main ways to do this. You can log on to one of our 3 self-service portals, and each portal is designed with the end user group in mind. So we have the provider portal, which serves our healthcare providers, whereas we have the pharmacy portal, which is intended to help our pharmacy personnel. Then we have our patient portal, which serves our patient and caregiver population, although that is not listed here, but we have that as well. And as we discussed previously, if you can also apply right on our website on the Disease Fund homepage, or you can give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Time at 866-316-7263. Next slide, please. So on average, it takes about 10 minutes to apply for assistance with PAN, and our approval decision is instant. We'll provide you with the enrollment details and claims processing information right away and follow up with an email or fax upon request. We also send enrollment details to the patient. And it is also important to note that you can start submitting claims for reimbursement immediately after your claims or after your application is approved. This is one of the benefits we have at PAN. So if you have the patient right with you at the pharmacy, once you submit the application and it's approved, you can immediately go ahead and process the claim for the patient so that you can send their medication. Or if you're a specialty pharmacy and you're ready to send the medication to the patient, you can do that. Or if the patient comes in for an infusion, you can do this right after you submit the application and it's approved. Next slide, please. So after your application is approved, there are a few things to consider about the PAN grant. So each PAN grant eligibility period is for 12 months. However, first-time enrollees in any disease fund are also provided a 90-day look-back period. This is to allow reimbursement for claims the patient may have acquired before you contacted us. We also have the grant use policy, which requires you to submit a claim and receive payment every 120 days to keep the grant active. Now, we know that there are some medications such as Prolia that patient gets every 6 months. And so because of that, they may not be able to follow this grant use policy. And if that's the case, we recommend that you either contact us by calling us, or you can send a message via our portal to let us know that the patient doesn't have to come in for treatment until maybe in a month or 2, but the patient still needs the assistance. So to keep the grant open, and we can do that, we can extend that grant use policy. And then the final assistance that we provide is that we provide ability to be able to renew your grant 30 days before the patient's grant period ends. So that means that if you can start applying for a new grant for another year, 30 days before the current grant ends. Next slide, please. So we want the reimbursement process to be quick and straightforward. So we provide several ways to submit your claims at PAN. So if the pharmacy can bill PAN electronically, and they can use the PAN ID, BIN, PCN, and group number that's listed on this slide. You can also find this information on the approval letter, the portal homepage, and the pharmacy billing guide, which is so important for you to have if you're going to be billing PAN, to have the pharmacy billing guide, because it has all the information, including all the group numbers for each disease fund. Another way to bill PAN is a doctor's office can bill PAN electronically, and they can use the payer ID on this slide. More details on billing for providers can be found on our provider billing guide and the portal homepage. You may also fax or mail your claims to PAN, or you can upload the claim on one of our self-service portals that we discussed earlier. And additional information on filing claims can also be found on our website at panfoundation.org under Get Help. We'll make sure that we communicate with you every step of the way until you receive your payments. Next slide, please. So now we understand that managing an illness is complex, and our patients who apply for assistance with PAN, they may need additional support. Next slide, please. So that is why we created a free web-based app called Fund Finder. Now, this first of its kind web-based app helps patients, providers, and pharmacies, as well as caregivers, track the disease fund statuses across the 9 charitable copay assistance foundations that we mentioned initially. You can simply go to fundfinder.org, or you can find the link on our website. Once you sign up, you may follow any disease fund and then receive notification alerts via email or text message when the specific fund opens at any of the 9 charitable copay assistance foundations. Fund Finder helps you to save time by not having to check multiple websites frequently. And our goal in doing this is to help you find the support and resources that you need to spend less time on the manual work. Next slide, please. So we also have other supplemental assistance program at PAN, such as the COVID-19 Financial Support Program. The COVID-19 Financial Support Program covers a range of services, and it includes over-the-counter and prescription medications, as well as medical supplies and equipment. We also covered transportation to medical or pharmacy appointments and groceries and meals under this one fund. In addition, we also have the Extra Help LIS support program. The Extra Help program helps limited income patients on Medicare Part D plan pay for prescription drug costs by dramatically reducing their out-of-pocket costs. There are 2 levels of coverage. So we have the full and partial Extra Help. People eligible for full Extra Help are automatically enrolled, so there's no need for PAN to come in to assist, but those eligible for partial Extra Help must apply to receive that benefits. So that is where we come in, and we connect patients with a case manager to see if they qualify for the Extra Help program, and then we provide support for completing the application. So to learn more, you can visit panfoundation.org/extrahelp. Next slide, please. So another supplemental program is our Transportation Assistance Program. This program offers $500 to grant recipients for reliable and affordable transportation. It covers all major modes of transportation and lodging using a prepaid debit card. We focus on accessibility to those with physical disabilities, mobility limitation, and hearing and vision impairment. Then finally, we have the social determinants of health survey tool that we created with strategic screening questions. This is to help improve patient support and treatment adherence. So the survey is available for all patient support organizations, and so any one of you can use it and to access it for your and use it for your to determine your patient's need. You can download it, the questionnaire at panfoundation.org/SDOH. So now I will turn it over to Amy, who will tell you more about our advocacy efforts and our alliance partners. Next slide, please.
Thanks so much, Audrey. We know that managing an illness or multiple illnesses can be quite challenging for patients. Patients may need information about their illness or disease. They may need information about how to manage side effects of their medication or simply how to adhere to treatment. They also may want to speak with other patients who are going through what they're going through. And that's why at PAN, we have aligned with what we call our Alliance Partner Network, 22 today national patient advocacy organizations that provide a range of education and support services to patients. We have groups like the American Lung Association, the National Kidney Foundation, and the Bladder Cancer Advocacy Network in our Alliance Partner Program. When a patient or a caregiver contacts PAN to find financial assistance, they're told about our relationship with the respective alliance partner, and they're simply asked if they would like someone from that organization to get in touch with them to talk about their needs. It's purely voluntary. We're really grateful that every year we refer tens of thousands of patients to our national patient advocacy partners. Next slide. A big part of our mission at PAN is to advocate for improved access to affordable care. Board-approved position statements that are all published on our website really help guide all of our work. An example of a position statement and a policy solution that we have long advocated for is related to having a cap on Medicare Part D program. For example, today, Medicare beneficiaries are the only insured population that does not have a cap on what we pay out of pocket for prescription medications over the course of a year. We believe there should be such a cap. So much of our work is done in collaboration with patient advocacy organizations and coalitions who all align with our mission. So how do we advocate and how do we educate? We do that in a number of ways. We publish educational resources all on our website. We often conduct national polling to hear from adults and seniors across the country about their challenges accessing their treatment. We meet with members of Congress and their Hill staff to educate them about the work we do at PAN and the policy solutions we believe will improve access to care. We lead letters and sign on to letters. And next slide, please. We also launch grassroots campaigns. We feel there is no more important work than to have congressional leaders hear directly from providers, from patients, and from caregivers about the challenges they face every single day. And so on our website, we have provided the platform to do just that quite easily. I encourage you to visit our advocacy section on our website to learn more, and specifically to learn how to become an advocate yourself. So now, Audrey, back to you.
Thank you so much, Amy. So as we're getting near to the end of our presentation, we want to encourage you to stay connected with us, especially after you enroll your patient with PAN. Next slide, please. So one way to stay connected is through our portals. We have 3 portals for the provider, patient, pharmacy, as discussed earlier. And on all 3 portals, you may utilize the following features. You can apply for a grant. You can add your patients to the disease fund waitlist. You can renew a grant, as well as link your patients to your account. In addition to, you can also review grant details and notification letters, as well as upload claims and view claims payment details. And then finally, you can communicate with our portal support team via secure messaging about the status of a claim and request a grant use policy extension that we discussed earlier. So if you have that instance where the patient still needs a grant, but is not able to submit and receive a paid claim, you can definitely contact us. We also send a reminder on the 90th day to let you know that we haven't received a claim yet. And that's a great opportunity to contact us through our secure messaging and say, patient still needs this assistance, but they don't have an appointment till maybe a month or two from now, so that we can extend it. We also understand that you're busy. So our portals features allow you to do all the things that you'll be able to do by calling us, so that you don't have to bother to pick up the phone if you don't want to contact us. Next slide, please. So another way to stay connected with PAN is through our newsletters. We have a general newsletter where you learn about upcoming events and our position on healthcare cost. In addition, we also have the provider and pharmacy newsletters where we share information such as about our program, upcoming events, tips and guidance to use our services, newly added disease funds, and stories from our patients and program representatives. You may also sign up for the NICA newsletter for more information about the organization. And that is listed on the very top of the screen. Next slide, please. So we know that we provided you with a lot of information today. And as Brian said, we will distribute this webinar and the slides to participants and those who registered. PAN Foundation is one of many resources to help your patients with out-of-pocket cost. We hope that we have provided you with helpful information today to simplify the search for charitable copay assistance or for charitable financial assistance. We encourage you to reach out to us to learn more, or for us to listen so that we can understand how we can help you. So to learn more about the PAN Foundation or our programs, visit our website at panfoundation.org or call us at 866-316-7263, Monday through Friday from 9 a.m. to 7 p.m. Eastern Time. And then there's also other resources here on this slide that you can use, which we have the Fund Finder, how to file a claim, where you can find multiple information on filing claims, specifically for providers and pharmacies. And then you can also visit our website as well that I mentioned earlier. Next slide, please. So you may also reach out to me using the email address on this slide. If you want to learn more or have questions about your patient situation, you may reach out to Brian at NICA for any questions about the National Infusion Center Association, and his information is also on this slide as well. And we look forward to working with you soon. And again, thank you so much for joining us today and for your time. And now I will go ahead and turn it back over to Brian, who will lead our question and answer section. Thank you.
Thank you so much for all that valuable information, Amy and Audrey. There was quite a bit of chatter in the chat function throughout the session, and we have received several questions through the Q&A function. In general, there was quite a bit to unpack and digest in there, so I'd like to ask a couple questions before we open it up to the questions that our audience submitted. So, first question, with so many support options available, how can infusion center staff find the right program?
Okay, thank you for that. That's actually a really great question. Thank you for that question, Brian. So finding the right program, I think, is crucial, as we discussed earlier, because you want to make sure that you enroll your patient in the right foundation according to the patient's need, and at the same time where there's funding. So I would say probably you have to do your homework. In this instance, find the disease fund that you are interested in. I think the first step would be to find the disease fund you're interested in on Fund Finder. And then once you find that disease fund, and there will be a list of foundations on Fund Finder. So once you get this foundation that you're interested in, look up the foundation and make sure that you are reviewing that particular disease fund. You're reviewing their eligibility criteria, finding out if the patient's medication is covered under that fund. Review all the guidelines that they have. Make sure that that the disease fund, verify to make sure that the disease fund is not commercial only, especially if the patient only has Medicare or vice versa. So it's very important to just do all that due diligence to review and find out if the patient is qualified for that assistance. Then after that, then you will need to review the assistance amount, I would say, to make sure that it's going to be enough for the patient. And if it's not enough, make sure that the program also offers additional assistance. So if the patient runs out of funding, you'll be able to get more assistance. So I would say that would probably be the best way to go. And Amy, if you have anything, you can add to that as well. Thank you.
No, I think you covered it all. I think Fund Finder, and I saw some of the comments in the chat, Fund Finder is a true time saver for so many providers and patients, because I can only imagine with such limited time how difficult it is to have to call or check websites of 9 different charities. So really do encourage all of you to register for a Fund Finder, and I'm sure it will be quite helpful to you and your patients.
Thank you for that. So takeaway for the audience, if you take one thing away from this webinar, bookmark fundfinder.org, go there every time you have a patient that needs non-manufacturer cost share assistance. So anytime you have like a Medicare patient, for example, non-commercial, so you can get a quick snapshot of programs that are still open, that have dollars available, and that portal is updated hourly. So keep checking back on the hour as new funds may be available. Also, I think you guys touched on this, once you all register for fundfinder.org, you can select areas that interest you and select how you would like to be notified when those funds become available in those areas. So a lot of questions that we got in the chat and in the Q&A were about, are there programs for this? Are there programs that provide assistance for that? And how do we know when funds are available and when new funds become available? Fundfinder.org. One-stop shop for a lot of those needs. Okay. How do people access some of the supplemental patient support programs and resources that you all mentioned? And are there any considerations or limitations to note?
That's another great question. So at PAN, we are committed to helping the overall patient. And so we've created certain resources to help the patient get that overall support. So I'll go over some of the ones that I went over, and then Amy can probably provide more details on accessing the Alliance and advocacy support. So the health, at PAN, the healthcare or pharmacy provider can enroll the patient in many programs, almost all our programs they can enroll. However, we require that the patient is actively enrolled in one of our disease funds for the transportation program. So there are, for those supplemental programs, we require that the patient or a caregiver applies for the patient so that we can, because we need to do additional follow-ups with them. And also because the claims process for that is a little different, because we provide the patients a prepaid card where they can use on their own. So usually we require that the patient or caregiver apply on behalf of that patient, The same for the COVID-19 assistance as well. For the Extra Help program, we reach out to the patient directly if they may qualify. And then from that point on, the patient can sign up for an appointment, and then we connect them with a case manager who will reach out to them to get them started on the process. So first they will review to make sure the patient qualifies, and then from that point on, they're able to go ahead if the patient qualifies, and they assist them with the application process. And so for that assistance as well, usually we reach out directly to the patient. For the social determinants of health, maybe I'll let Amy go ahead and also discuss that, as well as the advocacy efforts as well.
Sure. Thank you for that, Audrey. I think, when it comes to social determinants of health, Audrey spoke about the screening tool that we have created that practices and patient advocacy organizations and provider organizations can use to help identify the needs of your patients. At PAN, we are thinking about our growing role in this area. We know that we need to do a better job ourselves screening our own patients, and we're looking at ways to connect patients with the resources they need, whether it relates to food insecurity or their ability to pay their rent. Lots of times those resources are available at the local level. So we're currently exploring how we as an organization can do more in that regard. Couple of things that I wanted to mention around patient advocacy support and alliance partners. One of the features that we added to fundfinder.org over the last few months was adding patient advocacy organizations that support the specific diseases. And so when you register and go on to fundfinder.org, you will see a range of those organizations listed for every disease. With regard to patients who come to PAN and patients you may refer to us, the alliance partner opportunity is really automatic. So where there is an alliance partner that exists for that particular disease, we will go ahead and ask the patient or caregiver always whether they would like to be contacted by that organization. And then the process really is automatic, where the alliance partner is notified, and within perhaps 24 hours or a couple of days, that patient will receive a phone call or an email from the organization. So that process is automatic. Our goal is to have an alliance partner for every disease fund that we offer. We have about 2/3 or so of our disease funds covered by the alliance partners.
Thank you for that. Follow-up question. Do patients need to be enrolled in an assistance program to access supplemental support programs and resources?
Go ahead, Audrey.
No, I'll let you go.
The answer is no. They can enroll in our COVID fund. They can access a case manager if they need assistance seeking support for the low-income subsidy program.
Great.
Yes.
And what about patients? Sorry, go ahead, Audrey.
Yeah, I just wanted to add, I think the only program that they have to be enrolled in one of our other programs is the transportation. They have to be enrolled in any one of our other programs and be actively enrolled before they can apply for the transportation.
Great. Can patients that are using manufacturer cost share assistance, so commercially insured patients that are using manufacturer cost share assistance, can they access supplemental support programs and resources?
Yes, so as long as they qualify for the eligibility criteria, and each program has its own eligibility criteria, as long as they qualify for that, they're able to access it. So for instance, for the COVID-19 program, for instance, they can access it and receive that assistance. And one of the criteria is that they have to have either a rare, chronic, or oncology disease. So if they it doesn't have to be a disease state that we cover at PAN, but if they have any of those, they can apply for assistance, and they've been affected by COVID-19. So it's important to really review all the eligibility criteria for each disease fund to find out specifically what are the criteria for assistance, because there's so many different type of assistance that we provide, and each one has specific guidelines, and some even as far as the federal poverty guidelines, some are 400, some are 500. So it's always important. But I just to go back a little bit, for those that are commercially insured for the COVID-19, they must have Medicare health insurance. So I just wanted to point that out there. But for other programs, no, I mean, they don't necessarily have to have that. So it's important to check each one to be sure what the eligibility criteria is.
Great, thank you. So one of the main themes in the chat was charitable assistance dollars run out so fast. So clearly demand far exceeds supply. What can infusion providers and/or patients do to support expansion of these support programs?
Amy, go ahead.
That's a great question. I wish I had the magic answer to that. You're right, Brian, that the need out there far outweighs our ability, or really any of the charities' ability, to provide assistance. So, we do the best every single day to outreach with the donor community to request funds. That can be from the pharmaceutical manufacturers, it can be from corporations and family foundations, and even individuals who like to give to PAN. But, all of you are in a position to encourage donations to PAN. Sometimes when I'm speaking with the patient advocacy organizations, whether they're alliance partners or not, we all share a mission in terms of helping patients. And sometimes we even share donors, although we speak to different people at the donors. But I think the more we can talk, if we have contacts who are potential donors, the more we can talk about the need out there for charitable assistance, particularly for the Medicare population who really do not have any other place to go for assistance other than potentially using their savings, which we don't want them to do. The more we can talk about the need for charities like PAN and the need for assistance, I think, that would be a great thing if all of you can help in that way.
So, one word answer to that question: advocate. Get involved in advocacy. Engage with PAN Foundation and their grassroots platform, any of those campaigns. We have to mobilize and amplify the provider and the patient voices as it relates to the value of accessing cost share assistance. Until we can solve the broader issue of drug pricing, right? Drugs are so expensive. Until we can get to a point to where patients don't need cost share assistance, they're going to continue to need cost share assistance. We need to amplify that perspective. We need you guys to engage with PAN Foundation, with NICA. We can connect you with platforms to amplify those voices. We can direct those messaging to exactly where it needs to land to kind of move the needle here. Also, infusion providers and providers in general, as you're interacting with your pharma reps, encourage them to contribute more dollars. Constantly push them to contribute more dollars to these charitable foundations because there is inadequate assistance on that side. Quick little reference. NICA is building a strategy here to try and alleviate some of those pain points on the medical benefit drug side. Interested in learning more about that, email us at access@infusioncenter.org. Just reference cost share assistance for Medicare Part B. Okay. So, question that we got multiple times. Does cost share assistance apply to both pharmacy benefit drugs and medical benefit drugs? I can probably answer that yes. Great. Very important for both, critically important in the context of medical benefit drugs, which are generally much higher cost. How long do waitlisted patients have to apply after being notified?
That's a great question. So if the patient is on the wait list, they have, once we send the notification out, they have 48 hours or 2 business days to apply for assistance. And then at that time, we will review all the application that comes in, allocate the funding, and then provide the assistance. And then if there's money left over, that's when we open it to the general public so that anyone can apply from that point on. but they have 2 business days to apply. And it's important to kind of make sure that you're checking your email for when the notification comes in, because they have that small window to apply.
Great. And then for that notification, can users, either providers or patients, set up, like, get a text notification, for example, or is it only through email?
We're working on that. We have received quite a few feedback about healthcare providers and pharmacies requesting that they receive that, because it's easier and simpler to keep track of. But currently it's only through the email. So they have to check their email to get that notification.
Perfect. Love to hear that. If a provider's office also has a pharmacy, right? So either a physician office that has a in-office dispensing pharmacy, or an infusion center that also has, like, say, a home infusion pharmacy, which portal should they use? Healthcare provider or pharmacy?
That's also another great question. Now, it depends on how they're billing. So if it's Medicare Part B and they're billing, so it's medical, they probably should use the healthcare provider portal. Now, if they're just using the claims processing information, they're using the BIN, PCN group number, they're billing it through Medicare Part D, they probably should use the pharmacy portal to submit claims. But depending, if they're a pharmacy, even if they use the pharmacy portal for that, we still will make the payments on that. But as long as you can bill it electronically through pharmacy, is probably the easiest way to bill PAN. Although you can also bill electronically for medical, but that requires for you to be able to talk to your clearinghouse so that they can add PAN to be able to bill us medically. But I would say both, if you are using it, depending on how the medication is billed.
Brian, I think we have time for one more quick question.
Okay, I'm not sure we have any quick questions here. Okay, here's a final question. So can the cost share assistance be used for the patient's entire cost share liability for medical benefit drugs, which would be the drug and the administrative service? Or is it just used for the drug portion of the patient's cost share liability?
Amy, you can go ahead.
It's just to cover the out-of-pocket cost for the prescription medications.
Okay, thank you. All right, that's all the time we have. Give you guys a minute or so back in your day, but I think critical takeaway here, 2 takeaways. Fundfinder.org, sign up, get notifications, indicate what types of programs you're interested in, so you can get notified as funds become available, as new programs in that area become available. And second piece, advocacy. You guys have to get more involved in advocacy, both the providers and the patients. We're not going to be able to move the needle unless we can amplify the voices and perspectives of each of these stakeholder groups. So if you guys love the value of this cost share assistance and what it does for your patients, we need you to shout that value and share that value from every soapbox that you can find. And the PAN Foundation and NICA will provide you with more soapboxes than you could ever want in your life. So thank you all for participating today in this webinar. Thank you so much for our colleagues at the PAN Foundation for co-hosting this webinar with us. If you have any questions, please follow up with us offline, and we will share the recording and slides with you all in the coming weeks.
Thank you, Brian.
Thank you all.
Stay well.